ممتاز. اسمحوا لي بس في الأول يعني أعرفكم بنفسي. أنا أحمد عطية. بشتغل في الهيلث كير سبلاي تشين for the past 2 decades. I've been 20 years working in healthcare in Saudi, particularly, and in GCC in general. And I've been privileged, if I may say, that I handled so many applications in supply chain, and from a very small glove until a very sophisticated proton therapy for nuclear medicine. Moving on, all the small things, cardiac stents, disinfections products, full CSSD projects. يعني كنت الحمد لله محظوظ ان انا تعاملت مع ناس في المجال كتيرة جدا، ساعدتني واثرت معلوماتي على قد ما اقدر. آه، يعني I would like to walk you through the process today. Today I'm just going to give a glimpse about how efficient and how important is supply chain for IPC. IPC is very instrumental department in the life cycle of supply chain or in healthcare. A small defect can cause a very big problem. A minor misprocess somewhere can cause a disaster somewhere else. It has a butterfly effect. It has a very big importance. It's very important to incorporate our values of supply chain into the IPC. So I just gave a brief introduction about the supply chain management in healthcare in general. So our job is, some people see it, it's moving a box from here to there. Some people are seeing it as just purchasing an item which is related to certain application, and we help the team to process it. However, uh, being a passionate supply chain professional, and I do like my job, to be honest. I had so many chances to change it, but I didn't. Supply chain in healthcare ensure the continuous and compliant and traceable flow of product to clinical care and infection control. So what we do in supply chain in general is we do sourcing and procurement, and this is very important in our line of duty. We do storage and handling, and another important matter. We do distribution, and we do the reverse logistics. Why everything is important? Why all the pillars of us? Because any small step, that is any failure step in any given point of time, it will cause something. So if we sourced or procured the wrong project, we will not be able to deliver the right services. If we store it and handle it improperly, we will end up in having a defective product. We will compromise the quality. We will compromise the healthcare provided, and we will not be able to even uh, give the right treatment to someone in need. Our line of duty is very fragile, and because it's serving people that are in needing for treatment. The distribution, failing in distribution means that we will not reach the right person at the right time with the right product. So imagine that we are delivering something to a certain hospital and we didn't reach for a reason or another. And the reverse logistics is important to update our inventory and ensure that our planning is proper, and we ensure that we have the right stock. To be more specific and shed more light about infection and prevention control. Uh, Again, why supply chain and prevention control are very integrated, if I may say. It impacts the patient safety. If we procure the wrong product, if the product is unavailable, we will compromise both patient and practitioners or service providers or uh, healthcare doctors and staff. Uh, a hospital that acquired infection can result of from just a small infection to a loss of life, a reputational damage. And of course, this is translated to money, so it's a waste of resources. Uh, if we have an interruption in our supply chain process to the infection and prevention control, we will end up that we have shortages. We will not be able to apply our services to the patients and the people in need. Again, I stress on the thing that we in healthcare, everyone in healthcare is providing a service to people that are needing it, and this is where it comes the moral and uh, the social responsibility for that. Uh, Prevention failure means infections, patients that suffer, hospital stays, provide inability to serve more patients. And this is not aligned or conflicting directly. It's not about not alignment, or only a small alignment. It's conflicting with the vision and with where Saudi Arabia is going right now. Saudi right now, and take it from someone who's been there 20 years back, and I'm old enough that I operated in medical devices before SFDA controls the medical devices. When I reached Saudi Arabia, the thing was under control, only the pharmaceutical products and the medicines that was under the SFDA. So seeing the growth, seeing the direction of digitization and resilience and supporting the nationwide with healthcare, which will consequently elevate the well-being. And I think the well-being is something that is embedded or a major pillar in the vision of 2030. Again, I'm going to stress about the significance, where the importance and the significance things. Our essentials in IPC supplies is very important to protect people and patients and staff, to have it sterile and to be able to isolate the equipment. What happens if we have a risk of supply chain failure? We have disruptions, we have major outbreaks or small outbreaks. Actually, an outbreak is major, is something major. You cannot have a minor outbreak. Outbreak is something, yes, maybe it's on a hospital level, sorry, or on a building level or on a city level. However, but it's an outbreak. It's something that is spreading very widely and we are unable to control. Any sterility compromisation can lead to heavy infections. Any sterility disinfections will expand the stay of the patient in the hospital, utilize bed, and will not be able to serve another patient. This means that our service is disrupted. So whenever the supply chain is disrupted, consequently, the service and to the healthcare is also disrupted. I think we all lived COVID. We were seeing how the small face mask was very important, was very expensive. Because we were not unable to find it because there was a very heavy scarcity. Even this shows how significant and correlation between supply chain and IPC. The workflow for supply chain is similar. يمكن a little bit specific for IPC, ولكن in general it is the same. It goes first of all from the source, vetting the supplier, the product. Is it good? Is it quality? It will survive? How long it will last? The qualification of the product and the vendor. Uh, is it according to our standard? What are the risks associated with that product, with that supply? So both are very correlated. So a hard vetting is required, because if you fail, or if you collaborated with someone that will fail you, it didn't deliver on time or delivered a poor quality product, you will end up unable to serve your patients. We need to ensure the sterility and the cleanliness and the quality of the product. And for this, we need to ensure that the quality is very high along the way. So sometimes there is a very good product that is leaving the factory in not a temperature controlled vehicle. This means that the product quality will be compromised. Consequently, at the beginning, it was a good product, but due to mishandling or due to bad storage or bad transportation, it became a bad product. Expiry management is very important to ensure the resilience and rigorous of the supply chain that is available, because we don't want to end up with a expired product. That enable us not to serve our patients, and also to have a proper track record and to be ready with the system that enables you to have a recall. I think the recalls will shed more lights about it. It's very important to have a system that records everything from your receipt, from your dispatch. It was delivered to whom, it was delivered to which patient even. So I think we will have tomorrow we'll have a more elaboration about recalls, a more elaboration about how important is that. However, I think one of the major responsibility and the first responsibility for any healthcare provider, whether it's a hospital, distributor, manufacturer, is to have a proper tracking. So in order to get passed from SFDA or SEBAHI or any other uh, notified bodies or governmental authorities or any quality management reviewers, is to have a proper documentation system that shows your receipt, delivery, and storage conditions, and always to have this monitored. And I think if someone working with medicines, you will see that now the full cycle end to end is fully monitored by the SFDA, from importation, from transferring from on the shelf in the pharmacy to the last patient service. To talk about supply chain for IPC, let me put it this way, it's a clean to clean life cycle. That's the major thing, or the major topic that we need to maintain, to ensure the quality, to ensure that we have all the products uncompromised and ready to serve our patients. So our concepts are basically forecasting and planning. This is supply chain, supplier qualification, inventory control, specialized storage, and performance metric. This to ensure that our products are uncompromised, ready to serve, and also we have the right systems to fetch these products, and also to ensure that our suppliers are audited properly. Because without properly auditing your supplier and without being involved in the decision-making process, you will end up with either the wrong product or the wrong partnership with someone that will fail you in a delivery, and consequently it will affect your level, your standard level of your standard level of services to our patients. The cold chain and the clean storage environments are very vital, and it has to be closely monitored. Something what I believe in is the success factor for everything. I know this is very generalized, but I believe so, is the performance metrics. The KPIs is something that we cannot live without it anymore, whether we are, no matter where we are. And you cannot, because you cannot manage what you cannot measure. We need to measure everything. We have to have a proper KPIs about our storage, about our easy to fetch products, about the deliveries, about the levels. And this comes with also providing a green area to improve on how we can improve our service provider to the patients. Uh, this is also shedding the lights on the same, but I'm adding the things. This is more specialized to IPC. You need to plan and forecast your PPA, the antiseptics and sterilization material based on the infection that you want to prevent in a hospital facility. The sourcing also is very important, in my opinion, that we select that we select the approved and compliant. And nowadays you cannot choose any product that is not SFDA registered. And this is, I believe, this is very important because SFDA provide the framework that can make sure that the quality of product entered Saudi Arabia is very compliant with the standard and aligned with the goals of elevating the healthcare provided to people. The storage to ensure that the products are not compromised, the distribution, whether it's from hospital to a hospital, from a main warehouse of MOH to hospitals, from NOPCO, for example, to any other providers. I think this is vital to ensure that our products is reaching on the same time, because the whole supply chain used to be is the right product at the right time. If you don't have both combination, then you would not be able to have a good service level. Use and compliance, again, we're talking here about the protocols that ensure that our products are fetched properly, delivered properly on time, reaching the people in need on time, and also ensure that our supply chain is not compromised, and provides the KPIs for supply chain. For example, if you have the storage level is 5 pieces from a certain product that you will need, and this reached like 3 pieces. So now you need to reorder. So it goes back to planning. And so the distribution has to work out, the storage has to work out, the sourcing has to work out. This is why they call it a supply chain, because whenever a small item or a pillar or any chain is energized or affected, then the whole chain will work it on it again. The waste management is very also important for the well-being of the place, because it can be misused, it can be compromised, it can utilize your storage, affect your distribution. So the waste management in general is very important also to ensure sustainability, which is something that we are all keen about and we are all looking forward moving on. This whole thing is governed by a framework shaping the supply chain, or I cannot import any item from anywhere, from any country, for any hospital without going through certain regulatory bodies. And as I mentioned, I used to work before SFDA took control of the medical devices. However, I'm very happy to work with the Saudi regulatory framework. Saudi recently has been elevated to the 4th tier of regulatory bodies in the world. So the regulatory bodies in the whole world is classified into 4 categories. The highest is the 4th, and this is where Saudi, Australia, US, Canada, and all the big names are in there. So I believe this has a fingerprint on the service provided and also on the quality of the service provided. And also, yes, it's giving us a little bit hard time in registration, in control, and all these kind of things. However, I think that we are all happy with this because it protects us as human beings. So the main frameworks that are regulating and shaping the framework for supply chain is the SFDA, of course, NOPCO, MOH clusters, the WHO globally, the ISO 13485 for the production of healthcare facilities, and the GSI, which is the accreditation requirement tied with the IPC readiness for supply chain. These combined ensure that we have the right uncompromised product with a proper quality that is worth to serve to our patients and our people, and ensure that the quality standards are met. This will only happen if we have this in place. The GTIN and the UDI also is a very move towards tracing, because now you will be able to trace that specific product, that specific item, when to which patient. NOCO is helping a lot in shaping proper storage and planning and forecast and avoiding the outage of any product. MOH, of course, has the main role still, and also providing the right capacity, talents, and also the systems to ensure that that we are all updated and regulated to ensure that the quality of the service provided. So when I heard about the presentation, to be honest, I was never specialized in the IPC, but I figure out which areas we can integrate the IPC into the supply chain governance. Where are your involvement can be in the supply chain product? Because as I mentioned earlier, it's not about this is a supply chain professional and this is an infection and prevention control professional. This is something very integrated together. So the integration happens in the product selection, I believe, in the supplier qualification, in the performance audits, and this is going back to the KPIs. Performance is something extremely important. It's extremely vital to survive. You need to audit your process. You don't, it's not favorable to ensure that we are relaxed. This supplier is okay, خلاص, alhamdulillah, so we will not audit this supplier again. No, it doesn't work that way. Even your good supplier, even the confidence is built, even the trust is built, continuous audits has to be done in place to ensure that the product are not compromised at any certain stage, because sometimes the supplier is good, the product is good, however, this batch from this manufacturer has been compromised, and this is where we need the involvement of the audit. We need to ensure that the product is properly in place. So the incorporation of procurement, I think it's very vital. Review
أستاذ أحمد كمل لين نضيفك، لا تشيل هم.
اوكي سوري معلش. انا تمام كده. شايفين سكرين؟
اي تمام، بس سلايد شو الله يسعدك.
حاضر، ثانية واحدة بس ارجع لنفس السلايد. فالانتجريشن بتاعت الانتجريشن في الديسيجن ميكينج بروسيس بتاع البروكيورمنت I think it's vital to ensure that we have the right product and we have the right and we do have the right items to be served. برضو وانا ببحث في عن الحاجات اللي ريليتد للسبلاي تشين في اللي حصلت مؤخرا، لقيت كيس ستادي يعني انا بالنسبه لي كانت very alerting. because it was about a product which is artificial tears. I think I always use it in Riyadh, يعني, and I cannot survive without it in Riyadh. And unfortunately, this product was audited, approved, and utilized. However, one batch has a problem in sterility. It caused a very severe, it went up to death. And the statistics about the case that it resulted 81 infection, 14 loss of vision cases, and 4 deaths. يعني it's very alarming, and also gives you the significance of what could go wrong in case there is a process is compromised in the supply chain, and how important to be auditing your process and to avoid this matter. طبعا حالات العدوى كانت اكتر من كده بكتير، ولكن دي الحالات اللي هي كانت severely infected. في ناس بعض الناس بس that's it, and they managed to not even go to the hospital. But anyways, it can escalate in a very unpleasant way. How to maintain our product in a good and quality matters. We ensure the right storage, we monitor the usage, we follow the procedures, and we collaborate with everyone, with the vendor, with the customer, with the end user, with everyone in the chain. This collaboration and communication that differentiate us as humans. This is where our experience are built. The more we collaborate, the more we integrate, the more we follow right systems, we'll be able to excel. يعني مش ممكن يحصل development من غير ما يحصل communication and collaboration between different parties and different stakeholders. This is what we need to monitor and to ensure that it's happening on the right track. Trying to speed a little bit عشان الوقت، ولكن حديثي اللي فات my conclusion is our own integration supply chain and the IPC is the foundation of success. The collaboration between all stakeholders, vendor, distributor, storage warehouse, storage in the facility, IPC professional, end users, even patients. These collaborations and communications, I will call it, what will shape the next step, what will provide us with the process improvement, what will provide us with the areas that we can excel in, and consequently will build our progress forward. The regulatory compliance is our shield. The SFDA is our protector. هي الدرع اللي ممكن نحتمي بيه من ان احنا ناخد products unqualified, compromised, and counterfeit products even. Systems investment, I think, is the next step. Every one of us is using AI. Every one of us is using his phone for intelligent matters, but also the systems that are the backbone. And this is a good area to invest in data, which I think this is, and Saudi is doing it by default. And it's happening much better in many other places in the world. Tomorrow I will shed the lights on recalls, and please feel free to ask any questions. And I'm done with my presentation. Thank you so much for your time. أنا أتمنى أن أنا كنت ضيف خفيف.